Unit 6 deals with a text on the history of medicine, and the two terms that the general public may not be so familiar with are glossed for us. So once again, we need nothing but our wits about us to reason our way through these questions. Question 27 asks us why it is that chronic diseases were often mistaken for hereditary ones. And it's a fairly straightforward question because we can see evidence that disproves all three of the incorrect options quite clearly. So going from the bottom up, D, we know that the diseases are not associated with social deviance that this passage is talking about, because in lines 4 and 5, it tells us as much. Option C, required contact between blood relations to spread. Now, it says close family members, but the closeness is not biological necessarily, it's the closeness of living quarters. So blood relation was not a necessary condition for spreading. B, spread more rapidly than other diseases. Once again, in line 8, it tells us that these diseases were only mildly contagious. They would spread less rapidly than other diseases. And finally, A, typically occurred in cohabiting groups. This is our correct answer. Those most at risk may have been close family members who were cohabiting with other sufferers. So what matters is that these people were living in close quarters. They were living together. And de facto, this means that they were probably family, because families are groups of people who tend to live together. Question 28 tests our vocabulary as well as our reasoning powers. And going once again from the bottom up, what does the paucity of reliable pedigree data suggest? Does it suggest that evidence was available but poorly documented? Well, there is no suggestion that the evidence was documented, poorly or otherwise. D would imply that data is available, but it is messy or poor quality. However, there was simply not enough available data. C, did medical professionals ignore the evidence? Well, they didn't ignore it because there was nothing to ignore. We are told the evidence just wasn't there. Was the concept of hereditary disease based on faulty, defective evidence? The evidence was not defective, it was scarce, because paucity means scarcity. So there was very little evidence, not enough to arrive at any conclusions whatsoever. Therefore, A, hereditary disease was not arrived at via genealogical evidence, is the only answer that fits. Question 29 asks us about constitution. Line 15 has the words, the relatively unchanging individual constitution, and we are asked to comment on what the word constitution means in this context. And there are a few red herrings here. So going once again from the bottom up, each individual suffers disease differently. Well, no, because we are talking here about families. We're talking about hereditary disease. So while each individual may suffer disease differently, what we're talking about here, what the doctors of the time were talking about, is that constitution is inherited, and therefore families suffer diseases in similar ways, or at least suffer similar diseases. So D is out. Now, C is a massive red herring because it uses the political definition of constitution as a Bill of Rights, which has nothing to do with this text, so we can discard that straight away. A, you are not unique, strikes one as irrelevant most of all. It does say individual constitution. The constitution is at once individual and at least partly inherited. therefore you are not unique, doesn't really capture what is being said here. And finally, you were made that way ticks both boxes that we need to tick in terms of what the doctors of the time implied by constitution. The diseases were both incurable and hereditary. So the doctors had the patients think that their diseases were hereditary, essentially, because they could find no way to cure them. So you were made that way is in the spirit of what they were trying to get their patients to believe. Question 30 asks us how the medical professionals of the time came to adopt the concept of hereditary disease, how it came to be so popular. A would suggest that they did so reluctantly, for which there is no evidence. On the contrary, we see that it was a compelling explanation in line 19. B, inadvertently, did they adopt the concept of hereditary disease by accident without meaning to? Well, we see that it allowed them to save face. So it was done intentionally. Therefore, B doesn't work either. Did they do this as a matter of principle? Now, line 13 tells us that this explanation arose as a byproduct of certain factors, such as not being able to explain or treat these diseases. So they were not trying to prove anything, they were trying to find a convenient explanation to save face, which brings us to D as a matter of convenience. It was compelling, it was face-saving, and it excused their inability to treat these diseases. So therefore, D is our correct answer. Question 31 is a fairly straightforward question if you are on the right track with the other questions, because it just reorganizes the same data that we have already looked at and operated with. What prompted the idea of hereditary disease? That is closely related to question 30. It's essentially asking us the same thing, but in a different way. Is it a fear of contagious diseases? Now, we have already seen that these diseases were only mildly contagious, so the fear of contagion doesn't explain it. Is it a dislike of social deviancy? Was it an argument of morality? Well, once again, we have seen already that these diseases were not associated with social deviance, so that doesn't serve as an explanation either. B is out. Is it a fear of inbreeding? Now, the text does talk about families, but inbreeding is simply not mentioned anywhere, so we cannot read this into the text. However, a desire to both explain incurable disease and to save face so you don't have to admit that you have no idea why these people are sick. This is what we're looking for. Finally, question 32 asks us about the central belief on which the concept of hereditary disease was based. And this sort of question can seem complicated until you treat it as eliminating the options that are incompatible with the belief. This is what we're going to do now. Going from the bottom up, hereditary disease can be treated but not prevented. Now, we know because the text tells us that the medical professionals of the time were very bad at treating these diseases. So in lines 16, 17, it says that they were trying to rationalize their inability to treat them. So this would simply ring false. It does not accord with the information given to us. So D is out. C is once again trying to confuse you by using the political term constitution, in this case constitutionality, which is the property of being constitutional, i.e. of being in accordance with the rule of law, with the Bill of Rights, that is the Constitution. So that is completely off the mark. C is out. B, can constitutions alter after birth? Now, we have already seen in question 29 that there is this idea of fixity in the Constitution, which is why the concept of constitution was very much part of explaining hereditary diseases. Doctors were unable to treat them, so they used the idea of a constitution to explain why things just are the way they are, and there is nothing much that medicine can do about it. So B is out as well. And finally, constitutions are inherited. Yes, I mean, is this the central belief? There are several beliefs that are central to this explanation of diseases as hereditary. But what is important to us is that it is the only option that is compatible with all the information that we have. So A is your correct answer.